Welcome to the Close the Chapter podcast. I am Kristen Boyce, a licensed marriage and family therapist with a private practice, Pathways to Healing Counseling. Through conversations, education, strategies, and shared stories, we will be closing the chapter on all the thoughts, feelings, people, and circumstances that don't serve you anymore and open the door to possibilities and the real you. You won't want to miss an episode, so be sure to subscribe. Welcome to this week's Close the Chapter podcast. I am so glad you're here with me because this podcast is meant to open your heart, mind, and soul and spirit to think about things in different ways. And some episodes may bump up against something you have believed in or something you don't agree with. And I just want to say all is welcome, and that's okay. This is a topic, one that isn't really talked about that much. It's about understanding reproductive trauma, healing after unseen wounds. It's about loss that can affect the mother's life, and some hard decisions have to be made. It can be not being able to conceive. It could be a stillbirth. It could be multitude of things. So I just want to preface this episode with tenderness. And if you're going to listen, which I hope you are because you tuned in, take your time. If you need a pause at times, that's okay. If this brings up hard things within you, hold tender, compassionate space. And the one thing I love about reading articles, books, journals, podcasts, anything is that we can learn and grow. And sometimes in discomfort or a challenging thought, there's room for expansion. And that's what I want to hold today is a room and a place in your heart for expansion of self and compassion and grace. So I just want to say that as we get started on this episode. Let me introduce you to my guest today. Dr. Julie Bindeman graduated from George Washington University and is the co-owner of Integrative Therapy of Greater Washington, a private psychotherapy practice located in Rockville, Maryland. As a result of her own reproductive story, which she shares some on the podcast, she pursued postgraduate training in the field of reproductive psychology, where she actively writes, lectures, and presents on the topic. She has been on several committees for the Mental Health Professional Group of American Society for Reproductive Medicine and is currently serving on MHPG's Executive Committee, with her chair year being October 24 to 25. She's a member of a variety of organizations that are focused on maternal mental health. The governor of Maryland appointed her to serve on the Maternal Mental Health Task Force, representing psychologists in the state. There are so many more things. She is just an advocate, and she brings so much wealth of knowledge and really cares about this topic. And I think she has so much compassion because she's gone through a trauma and holds space for other people without judgment, without being told right, wrong, good, or bad. And trauma is trauma. So I want to hold tender, compassionate space for anybody who is holding any kind of trauma, whether it's reproductive trauma, maybe your mother or biological mother or someone in your life has gone through a reproductive trauma, or a sister or a neighbor, friend, cousin, aunt, whoever it is. I hope we can hold more compassionate space without judgment for what people have been through, for their stories. And I hold such tenderness in my heart for anybody that's walked through hurt, pain, loss, and grief. And I hope you can too. So if you also want a journal to go with this, it's free. You can get it at Kristen, Kristen, Boyce.com/free resources, and it will be sent to you. So please share this with anyone you know going through something that they need to know they're not alone, or maybe you want to show that you care about them. Let's all come together so we can have these kinds of conversations. Let's have deeper conversations with people. It really, truly makes such a difference in connection. Vulnerability matters, and sometimes it's hard and scary and uncomfortable, and that's where the healing begins. So here is my conversation with Dr. Julie Bindeman. Welcome to this week's Close the Chapter podcast. I am so excited for my guest today. It's a topic we haven't dove really deep into, and I would say this is a topic that affects so many people. that it goes unsaid and unspoken. And to put a voice to it, I think matters. So, Dr. Julie, thank you for joining the program. And I'm so excited to have you today.
Thank you so much, Kristen. I'm so happy to be here.
Thank you. Okay, let's talk about reproductive trauma. First, let's introduce the audience. Tell them a little bit about how you got started in this work and why you're passionate about this.
Absolutely. So most people don't know that reproductive trauma is something that they can work with. It's not something we learn in graduate school. I imagine you did not learn it in graduate school. And so I had to find it at first. And I like to say me, like many of my colleagues, came into this work very organically. So what that means for me is I had a child and the first several months were really rough. I wouldn't say I had postpartum depression, but I was very aware of my own mental health history and that I was at risk for postpartum depression. So after actually having a kid, I got really interested in it. So I went and I learned all the things that I could and started working with people that were pregnant, that had postpartum maybe before, and were trying to come up with ideas about not having it the second time around, or people that found themselves unexpectedly postpartum. As my partner and I continued to build our family, this is where I sort of got exposed to all the other things. So just through our own family building journey. So we had a journey that contains secondary infertility as well as recurrent pregnancy loss. Those would be words that at the time or even after I was like, no, that's not me. That's not descriptive. And the reason I say that is because I never had fertility treatments. So how can it be conceived as infertility if I've never needed to remedy it with fertility treatments? This is where recurrent pregnancy loss comes in, which is considered to be underneath the banner of infertility. And sometimes there's treatment for it. Other times there is not because it's unexplained. So that's kind of where we fell. And what was happening for us is we had a miscarriage, which was awful. And I was told just to get pregnant again. I did. As I said, I don't have difficulty getting pregnant, which I also understand that people have suffered infertility. They don't want to hear that. So it's always a strange thing when I'm saying this. And then we had 2 more losses that were based on a brain anomaly that was thought that both of us were recessive gene carriers for. And because we didn't know the gene, we could not avail ourselves to the technology that existed. So our advice was, well, just keep on getting pregnant. And when we can see this brain thing differentiated around 18 weeks, we'll let you know. At that point in time, I started being like, okay, well, let's just create embryos and we'll get me pregnant and we'll get a gestational carrier pregnant and we'll do all these things because all I want is a baby. I was so focused on having that baby. It meant that I was really unfocused about my own mental health because it really suffered during that time. And we are very lucky that we have a happy ending in that I had my daughter 14 years ago as of last week. And I had my youngest child 12 years ago. So after that, we're like, okay, we are done. No more. This phase is done. But as I was on that journey, I continued to seek out education really, because it, again, not something we learn in graduate school. And then being able to look at it through the lens of trauma, that came on later in my work, but really being able, and it was a colleague who had said to me like, wow, you've had so much trauma. And I'm like, no. Oh, yeah, I have. So even just having that kind of lens was really helpful to call it something that like, there is a reason why this is really hard for my nervous system to get over. And I put that in quotes since this is a podcast. So that's really how I got into the field. I didn't want to stop learning. And so I kept on learning. I kept on doing this work. I expanded out to all the various ways that one might be able to create a family. And it's just work that I love.
Yes, I can see from your own experience, you have this connection to it and you have passion for it. So thank you for sharing your story. How would you define, if folks are like, well, I don't know if I have reproductive trauma, how would you define reproductive trauma?
I define it pretty broadly. So I work with people who are contemplating having a kid. I work with people who are discerning about continuing a pregnancy. I work with people who have been trying to have a kid and it's not working. So that might be infertility. I work with people who are pregnant and experience a loss. And the losses I work with are any kind you can imagine. So most common, miscarriage, stillbirth, but also I work a lot with people who have terminated for medical reasons or otherwise sought out abortion care. I think that's a really important thing. I think it's an important thing for clinicians to know about because this is going to sound like a broken record. Did not learn it in grad school. Not even mentioned, I think. So that's a bummer. I had to sort of figure that out on my own, which is like, okay, what is different about these kinds of losses than other kinds of losses? And so I was actually guided by my own experience because the second and third loss were actually terminations for medical reasons. They both occurred in the second trimester. They were both for a brain anomaly that could not be detected any other way. And they were both devastating.
Yes. Would you put a hard birth or difficult birth, traumatic birth in there?
Thanks for moving me along. Yes, absolutely. Birth trauma is very real. And birth trauma doesn't have to mean that someone was about to die giving birth to their child. Birth trauma can look so many different ways. It might look like I had to deliver and my kid was extremely premature. And so typically that is not a situation that we aim for. That can be experienced very traumatically. It could be just the doctor or the nurse's manner that can be really traumatic for some people. It can be too the birth that they plan and not what they lived can also be something that's really traumatic as well. And certainly the near-death experiences or the loss of a child in the birth situation, all of those, an infant loss, just to also include that as well.
Yes. I also think, and you tell me what you think, if you have a bad experience with a doctor, an OBGYN, you kind of alluded to that when you're giving birth, or any time in the process, whether it's you're looking at reproductive, you're going to the OBGYN for regular appointments, would you consider that traumatic if you have a adverse experience, I would say, with a doctor or a nurse practitioner or a healthcare provider?
A general nurse practitioner, healthcare provider in a different setting. I just want to make sure I'm tracking correctly.
Yeah, like OBGYN. You're going in, you're having a pap smear done. Let's say that becomes a traumatic experience. Would you
Sure. Oh,
consider
absolutely.
that? Yeah. Okay.
Absolutely. So obstetric violence, which doesn't just have to happen in the delivery room, absolutely a trauma.
Yes.
And that violence doesn't have to be physical pain. That violence might be being dismissed, being discarded, being ignored, all the things that women never have to see in their own healthcare. We're never dismissed. We're never ignored. We're never called hysterical. So there are some systemic things that we need to work harder to eradicate, but also those kinds of systems cause trauma. Even accessing the care can be traumatic if you can't access that care because you don't have a provider nearby or you don't have insurance or the other kinds of financial means that you might need to have. So I don't think we think about those pieces, but even just the not getting care for regular GYN checks and then having so much pain to have to go in and figure out how to get there or how to pay for it and finding out now there's cancer, something that might have been very preventable.
Yes, that's so true. What are the symptoms if someone says, I think I might have reproductive trauma? What are some of the symptoms that you would say, okay, this is what I'd be looking for?
Yeah, certainly depends on the journey that they're on, but typically it can't be around babies, really hard to be around pregnant people, really hard to go to baby showers, those kinds of things. Really hard to metabolize the news when a friend or a family member is pregnant. Those would be some of the things that I don't think we look at as clearly for trauma, which is why I'm talking about it first. Absolutely flashbacks, absolutely some of the other kinds of typical symptoms we might see for trauma. But what I tend to see is when it's really hard to recognize that the trauma happened, it is in the past because the nervous system hasn't metabolized that. And so in the present can still get very triggered by it. And not just by the baby showers, but also going into a doctor's office could be triggering. all sorts of different kinds of things.
Yeah. And so your emotions of like maybe anger is kind of pervasive, or maybe sadness, maybe a combination. So would you say those are also ways that we haven't really maybe processed
Metabolize.
everything? Yeah.
Yeah. And I think it's not about me labeling what is traumatic for a person. It's about them feeling that sense, or that word makes sense to them. And there's occasions where I'll say, wow, you've gone through so much. For some people, that would be very traumatic. And at least just kind of put out there the concept of it. And if they grab onto it, fabulous. If they don't, that's fine too. We can still do things to help the nervous system metabolize, even if we're not labeling it trauma.
Let's talk about body memory and how that
Yeah.
is connected to reproductive trauma.
Oh, 100%. Yeah, because reproduction is happening in the body at a very cellular level. So I am trained and I am certified and I am a approved consultant for eye movement desensitization and reprocessing, also known as EMDR. And I'm training to be a trainer. So all the things.
Hey, I love that.
Yeah.
I love you.
Yes.
So I'm an EMDR practitioner, and so are my team of clinicians. So
amazing. Yeah.
That's
Many on my
exciting.
team, I'm like, you all need to get trained in this. And so they jumped at that, which is awesome. But what we find from that model and that learning is that our body takes in so much information. Our body and our brain takes in so much information. And there's an overlapping neurological process in which to metabolize. Because I think that's like the easiest way for people to understand it. So like to break down, to sort, or to understand what has happened in a day. Oftentimes we do that in sleep because that's a very useful time to do it. We're not really doing much else. So that's what I also say to my clients is your brain has known how to do this since day one. You and I are just guiding it. So there's things that have been clogged that we might call them trauma. We might call them something else. And we need to kind of flush that out of your system so that it can be sorted in the way that it needs to be sorted and not feel so present, particularly when it's in the more distant past. So with EMDR, I don't know how much your audience knows about it or not.
You share away, because some people might be listening for the first time and have no idea what it is.
Okay. So the idea about EMDR is it's a bottom-up kind of therapy versus top-down. So typically when we go to therapy, whether it's CBT therapy or psychodynamic therapy, whatever kind of the name for it is, that's a top-down therapy. We sort of start with the symptoms and whatever and kind of work our way down as best we can. The difference with EMDR is it's a bottom-up therapy. So it's looking at roots and then from there, getting up to the present. So it's a really beautiful thing because it also incorporates not just the image of the memory, if that is how you experience memory, but also the emotions of a memory and the body sensations of a memory. So it's really bringing in all these different parts of our brain that enable us to remember. And some of that is very somatic. Like it's not necessarily something we're conscious about, but we might have a smell and, oh, that takes us back. And that can be a really useful, good thing too. If you smell something that somebody who's passed away that was very meaningful to you had around them, then that can be a really pleasant kind of recall. So that's sort of like the general piece that I'll say, just trying to get it as understandable as possible and not get into the weeds.
I love that. That's so helpful because so many people are like, now what is EMDR? And I love it when people could explain it in different ways. So it might resonate with someone. They go, oh, that makes sense, because you're moving it up and out of the body, which I love about EMDR. It's like all that was held in the body and trapped. We're like, okay, we're moving it up and out. And I love that with reproductive trauma, we can work with a trigger. So if someone is triggered by someone's pregnancy announcement or baby shower or going to the doctor or getting a pregnancy test or whatever that is, we can take that in EMDR and use that as what we call a target.
Absolutely.
Decrease the intensity of that level of disturbance. So if you are really highly disturbed by it or really upset by it, we try to decrease that so it's less disturbing. Doesn't mean it erases it. It just decreases the intensity.
What I tend to tell my clients, and now this is going to beat me in terms of my age, but With EMDR, it's not like in Men in Black where they have that little thing and they flash it, your memory's gone. What EMDR does is enable you to look at a traumatic past event and be more of an observer about it. Like, oh yeah, that happened. It was really awful. Versus looking at it and having your entire nervous system activate again as if it's happening right here, right now.
I love that. I like that analogy because you're like, we're probably vibing on the same time frame of life. So that's a helpful way for clients to conceptualize it because they think it's like this weird thing we're going to do. They're like, this is weird.
Right.
I can feel weird because we're working with right and left hemisphere. And when you can allow yourself to just lean into the process, you will help clear and free yourself. The shame of many things, I think, the shame of maybe feeling responsible or feeling like you did something
all the
wrong.
time.
Talk about that because I think that does tie in.
And I think the negative belief I tend to hear most often is I am broken or my body is broken. So that is something, and as well as it's my fault. And so I always like to try to get underneath the it's my fault. I'm like, okay, so what does that say about you? And then sometimes people can be like, well, I must be bad. I must be toxic, whatever it might be that's underneath it. And so those cognitions don't begin with infertility or they don't begin with pregnancy loss, which can feel really hard for people to recognize because there's such powerful cognitions in the here and now, particularly around a specific event that was fairly recent. But what I like to explain to my clients is that has been in you for a really long time. Never about this particular reproductive thing, but it has been in you in other kinds of ways. And so now this reproductive matter that you're experiencing is the most salient of them, but it's also picking up all those other ways that you have felt broken, or you have felt like you're a bad person, or you have felt like it's my fault. So we're really kicking up a chain. I like to describe it too as like a chain where we're putting like one link underneath the other. And so it's not just what's happening now, but it's all that you don't realize that's underneath too, which is also coming up. So the idea is if we can help what anchored it, where that chain kind of originates, and we can help other events, we can help this present event, and we can even help fearful nearby future events. So if I'm talking to someone, we've been doing EMDR about pregnancy loss, and she's telling me, oh, I now have to go to a baby shower. And like that's coming up in a month. And it's a very good friend of mine. So I don't want to not go, but also I don't know how I can go. We might target that as a future event, not a future template, but a future event that we can also bring down the temperature of. And that can be so useful as well.
Extremely useful. I think that really helps empower people to say, I can handle this. Because a lot of times it's like, I can't handle this. I don't want to do this. I don't want to face this. And it's inevitable. There's a part of you that says, but I really want to go and support my friend. Yeah. So I think those are so helpful to folks that know that there is a possibility on the other side that you can move through this and get to the other side. Otherwise, Absolutely. It feels like you're not going to be able, you feel stuck in it.
Yeah. And that also, that sense of stuckness, that sense of this is always going to be, because I think when we feel stuck, that's kind of the next thought we have, which is, I will never get out of this. This is how the rest of my life will look. And I know people who feel that when they initially have a baby and the baby's not sleeping through the night and they're just sitting there being like, I'm never sleeping again. And it's very hard to imagine you will. I can't tell you when, but you will.
Yes. It gives people hope that, oh, okay, I can work through this and get to the other side. What are some other things people can do that have experienced this traumatic, I would say, reproductive traumas?
Yeah. I mean, all these additional wounds, right? I think, again, it really depends on the person. So for some people, support groups are awesome. They really appreciate knowing they're not alone, that sense of isolation they might have otherwise because no one in their friend group has experienced what they've had or what they're experiencing. So for some, those groups are just a lifesaver or a lifeline. Like, okay, cool. For others, I don't want anyone else to know my problems. I don't want to have to talk about this. I don't want to be sad for other people. I don't want to hear about other ways that this could have been worse. And so for people who have that kind of mindset, support groups are not useful. It might be that using the other hemisphere of the brain that they don't. So typically, if someone is very logical and very detail oriented and data driven, we think of them a little more as left brained versus right brain. And so for that person to do something like creating something that doesn't have a guide in how you create it. So we're not talking about coloring books where you're filling in the things, although those might be a great exercise into it, but it's what can you create based upon whatever medium you wish. And that I think can be really freeing for people because it's like, okay, well, I know this is not my strength. So let me see what I can learn about it. Let me see what I can take in about it. I think talking is really useful. So whether you have a friend, a family member, or a therapist, talking about it is really useful. And as I keep saying, this is not something that we learn in grad school. And a lot of clinicians will come to this work. Similar to me, I had my own story, but I made sure that I did my due diligence in learning and training and consultation before I was like, cool, this is now a specialty area. I just thought that was so, so, so important to do. But so many come to the field as, well, I have my story and therefore I know. And there's a danger to that in any kind of area that we might come to. So frequently, this is also with substance use and with eating disorders that like I've had my own journey. It's made me realize this work is really important. I want to help others in the way that I was helped. But if you're not also learning how other journeys might look, then you're doing a disservice to your clients because their journey, even though topically is the same, it might not feel the same. It might not look the same. They think about it differently. So if we're going into it being like everyone feels the same as me, just not true.
That's so dangerous because we project then onto the client our experience and we think, well, this is how you're going to feel. And it's like, well, no, not necessarily. Yeah. I'm wondering, this is a tougher question. And this is probably a deeper question because as we know, the body holds lots of memory. How much do you run into sexual abuse when it comes to reproductive trauma? Because sometimes they can get linked together. So I was just curious on what's your experience with that. Not always the case. I realize that. So I want to make this plain.
Yeah.
It's more of how often do you find a connection?
I don't know that I can necessarily give you like a percentage around it. It certainly exists. It's certainly something even more shameful. Oftentimes people don't want to talk about it. Having previous sexual abuse or sexual trauma actually, and not having therapy to address it, that's actually the big caveat, can be a disqualifier for someone who wants to be an egg donor or a gestational carrier. So that's totally different than what we've been talking about, but just getting a sense of that. Because the body remembers things could come up in birth. So I really do like to address trauma, any other kinds of trauma that they've had, that a client might have had. And should we be lucky enough to be working together where there is an impending live birth, being able to work with the idea of in labor, you get how like wrapped up we might be and sort of like we keep ourselves under control, whatever that might look like. Labor is a time where that is not something to rely on. That's not going to be like your go-to is I'm just going to think my way out of this. And it's very much a time when your body feels out of control because natural process happening, we cannot control that. So that becomes also a difficult piece to remember. So I'm like, we need to deal with past sexual abuse or past sexual trauma so that you're at a minimum of it coming up versus being unpredictable.
Yes. There's so many traumas that the body holds. So I was going through as we do, therapists need to be going through their own therapy. We were doing some kind of regression type work. And my mom had told me my umbilical cord was wrapped around my neck at birth. And so that was something I needed to work. My body remembered that. And so it's hard to go, well, how can you remember? Well, I didn't cognitively remember. My mom told me and my body, I could feel that. And so I had to do that body work through EMDR to clear that sensation. And so if we have any in utero trauma, maybe birth mother had trauma, maybe you had delivery trauma as an infant. I mean, these are medical traumas that you might not have considered. Those, I think, also can really impact our nervous systems.
Oh my God, 100%. And even the nervous systems of if you are a cisgender woman who has able to have a child, particularly if a assigned female at birth child who identifies as female or at least is reproductively using those female capabilities. I'm really trying to like make sure my language is very open because I know that it's not just women that get pregnant. So I think, again, like that's a side note, but still really important. In addition to EMDR, there's some other incredible somatic kinds of therapy. I was doing body work yesterday with the practitioner I check in with. And when we were talking about it, I have this back pain. Initially, it was because of a disc. We worked on that. That got fine. I'm working with a PT too, but I'm like feeling it in my whole back. And I'm like, I don't know what that is. Like maybe I went on a long walk. Maybe that's it. And after we finished the work, she's like, the stuff you were talking about, she's like, that's old. She's like, that's coming from in utero or like infancy kind of memories your body is now able to kick up. And I thought that was a really interesting thing where it's like, this has always been in you. It couldn't be paid attention to because there's all this other stuff happening. But now we can pay attention to it. And now we can help the body rebalance itself.
It's amazing what the body will do. Have you read Amy Griffin's The Tell? I had several clients tell me about it, but Oprah got a hold of it. It's a memoir, and she's telling about her life story. And The Tell is about telling is the therapy. And she goes through some specific therapies. I don't remember all of them. But the gist is she had this back pain, and it was in the lower part of her back. But it was connected. I don't want to spoil the book, but because there's much more to it than this. But it was connected to sexual abuse. And this is just disclaim if anyone might get triggered by this. But he was holding his foot down on her lower back. She didn't know that. That was a suppressed memory. And through the therapy, it came out. But how powerful the body is. And this is hard for us to comprehend. I think that how in the world could that be a pain now?
So what I was realizing I was originally trying to start to say is that I've already passed on whatever genetics and epigenetics and generational traumas that I can pass on, but they all live in me. And so they will impact my grandchild, not necessarily my child, but certainly my grandchild as they develop, as they get older. So trauma is such an interesting thing because it doesn't have to be known trauma. It doesn't necessarily have to be the one we carry. It might be something that has come down to us generationally.
And I love this book. For some reason, it's right here. It didn't start with you.
Yeah.
By Mark Wolin. And that's what you're talking about, this generational trauma.
Absolutely. Yeah.
Speaking of books, I love books. I have way too many.
Me too. Me too.
Like, this is my kryptonite. I'm like, oh, that sounds like a great book. And then I have a stack. You know how it is. What are some of the most impactful books that you've read that you'd say they made the biggest difference in your life?
I'm probably talking a little more about like clinical books versus I go to rom-com just to like chill out and I try not to read too
many
much
self-help. I know.
Or not even the self-help, but like the didactics.
Yeah.
Because I was reading this fabulous book, but it was very didactic and I had to like read it in small chunks, which was a challenge given the fact that I was introducing the author at a book festival. So I'm going to just bring this book up so I don't butcher the title and can make sure that people can see it. But otherwise, a book I love is Reproductive Trauma, which is the second edition is by Janet Jaffe. It is amazing.
I love that.
Again, like this idea of we come to childbearing with story we've already been telling ourselves. We meet our partner, they've had their own story. And then we have to figure out what is the story we want to build together. Okay, so the book that I recently read that was incredible is Sex is a Spectrum, and it's by Agustin Fuentes. And it really speaks about the scientific knowledge we have across the fields of anthropology and biology and psychology to discount the myths around binary genders and looks at different species and as well as humans, but such an interesting way that he conceptualizes that it's not either or, that it's always been a spectrum. It always will be a spectrum, and whether we want to acknowledge that or not. So even being like sex assigned at birth, he's like, well, that's also not a binary. So just super, super interesting. And it's really spoken to me clearly. I'm trying to think what other books beside my trashy books, which I love, but also it's like, all right.
Yeah. Those are great suggestions.
Give me a Jennifer Weiner book any day and I'm in.
We have to go someplace where we take a break and have fun and have some joy and have some relief.
Yeah.
So I think trauma can be heavy. And so we look at where can we get some reprieve? Where can we get a pause? And sometimes books give us that, different books. And then other people, information's really empowering and really helpful when we're going through a trauma to understand it, to name it, to make sense of it. So thank you for those resources. I really appreciate
Absolutely.
that. Is there anything we did not cover that you feel like is really important to talk about when we're thinking about reproductive trauma?
What I hadn't yet spoken about and just want to put an asterisk by is that reproductive trauma is not limited to what I've talked about. It often includes postpartum. And so whatever kinds of postpartums you thought you were going to have, that experience, what you were wishing for yourself, versus a potential reality of experiencing depression, anxiety, or what I tend to be seeing more is OCD, obsessional compulsive disorder. Like it never really manifested for someone until their postpartum. That's just an interesting thing too that I think is just important to note.
I'm really glad you said that because I see that too with many clients. They're like, I did not have this, but now my anxiety and OCD is really off the charts. So I'm glad you mentioned that. I think that's really helpful for people to know. And I know we didn't break that down today, but I think it's important to make a note of that. So where can people find you? If they're like, I love Dr. Julie and I want to know more, where can they find you?
I'm trying not to be as engaged on the internet anymore or like social media because it tend to not find it helpful. And I'm really trying to put my efforts and energies into things that I find helpful. So I have an account on Twitter, now known as X. That's just at Dr. Julie B. I have Instagram account and I have a Threads account and I have a Blue Sky account. And they're all Dr. Julie Bindeman, whatever the other stuff that you need to get to it.
And then do you have a website for folks?
Yeah, absolutely. So my website is called greaterwashingtontherapy.com. And that is the practice that I am so lucky to co-own, as well as our wonderful clinicians, and certainly more about me. If someone really likes geeking out or is a clinician, I just edited a book that was released. I'll hold it here, but it's the Mental Health Clinician's Guide to Abortion, Handbook for Abortion Care. I kept calling it different things in my head as I was writing this. So I'm like, oh yeah, that's right. This is what we settled on. So I highly recommend it just as a really deep guide in understanding all the complexities around all the different circumstances in which someone might seek out an abortion.
Yeah. And we don't talk about that as much as we could. So thank you for writing that. And thank you for joining me today. I'm so grateful for you and your work that you're doing in this world.
Thank you.
And making a difference. We get one life on this earth at this time. And just thank you for following your heart and what lights you up because that helps other people. So thank you for having this conversation with me. And I'm grateful for you.
Likewise. Thank you so much for having me.
Thank you so much for listening to the Close the Chapter podcast. My hope is that you took home some actionable steps along with motivation, inspiration, and hope for making sustainable change in your life. If you enjoyed this episode, click the subscribe button to be sure to get the updated episodes every week and share with a friend or a family member. For more information about how to get connected, visit Kristen, Kristen, Boyce, Boice.com. Thanks and have a great day.